Okay, so we are talking about diabetes, and diabetes, we all know, is a group of different disorders, but they are basically characterized by high blood glucose levels, either caused by insulin resistance in defect in insulin secretion, or in most cases by both. And of course, the hyperglycemia is per se can cause symptoms, but the most important thing is that chronic hyperglycemia can cause complications, including eyes, kidneys, nerve, heart, and blood vessels. And if you look at the a different kind of diabetes, we have type 1 diabetes. Of course, there is an autoimmune destruction of the beta cells. There is absolute insulin deficiency, and the only treatment is insulin. Type 2 diabetes is clearly the most common disease. About 95% of diabetes in the world is type 2 diabetes, and they are both defect in insulin resistance and insulin deficiency. There are some other more rare kind of disease, the monogenic disease, the MODY disease, which is probably less than 5% of diabetes. Single gene abnormalities, glucokinase gene is one of the gene involved. We still see quite a bit of diabetes associated with exocrine pancreas disease, patient with acute pancreatitis, chronic pancreatitis, patient that had surgery for pancreatic disorders, and there are some rare genetic forms. And then, of course, during pregnancy, gestational diabetes is present, and gestational diabetes is a very high risk factor for the development of type 2 diabetes down the road. And the data from, and this is data from the International Diabetes Federation, are showing that diabetes is growing dramatically. In 2015, in the entire world, there is almost 500 million patients have diabetes. And in the next 20-25 years, another 200 million patients are predisposed to develop diabetes. And diabetes is prevalent and is growing all over the world, in every continent, in every country. And in terms of the impact of diabetes, now every year more people die of diabetes than from HIV/AIDS, TB, and malaria combined. So let's talk to type 2 diabetes, the 95% of diabetes. So type 2 diabetes has a strong genetic basis for the disease, and it is the consequence of insulin resistance, mostly at the liver and skeletal muscle level. And then, of course, failure of the pancreatic beta cells to compensate by producing enough insulin. And type 2 diabetes can develop with age, physical inactivity, and obesity in subjects who have a genetic predisposition, or also in subjects who have experienced an adverse intrauterine environment. We know that a lot, that fetal malnutrition can result in a very high risk of developing type 2 diabetes down the road. For the genetics of type 2 diabetes, we know that the concordance in monozygotic twins is 70% or more. And for the last 10 years, with all the gene studies, we have found that more than 100 genes have been identified with susceptibility for diabetes. However, the risk for each of these genes is very small. And if you estimate the effect of all these different genes, they only account for 10% of the risk of developing type 2 diabetes. So we still a lot that we need to learn about genetics of diabetes. And out of these 100 genes, some have been identified, and they are almost all involved in beta cell function. Now, we also know that predisposing factor for type 2 diabetes, like obesity, physical inactivity, affect the DNA methylation, and it can induce epigenetic change in gene transcription in the target tissue for insulin resistance. So if we look at the schematics here, we clearly, a genetic predisposition is important, as well as lifestyle factor, obesity mostly, that induce insulin resistance. For someone that is not predisposed to diabetes, the pancreas compensates, the pancreas becomes the beta cell become hyperplastic, and enough insulin secretion is there, and you still have normal glycemia. But if there is beta cell failure, then there is the first step, impairs glucose tolerance, and when the beta cell failure becomes more severe, then we have the development of type 2 diabetes. Obesity, the linkage between obesity and type 2 diabetes, excuse me, is very strong. These are the last 20 years worth of data. Obesity in the US has increased dramatically. In the 1990s, most states had about 10–15% of population with obesity. 20 years later, we are almost at 25–30% of patients with obesity. The only good news, if you look at the most recent data, these are data up from the CDC up to 2014, the prevalence of obesity over the last 2 or 3 years seems to be staying stable, with the incidence of diabetes perhaps coming down. So we hope that this exponential growth on diabetes is not going to continue. Now, obesity is not just in the US, it's worldwide. So these are number of countries with the data from the 1980 to 2008. So over these 30 years kind of data, the percentage of patients with overweight and obesity has doubled in China, has increased doubled in Mexico, South Africa. Pretty much every country and every continent the prevalence of obesity is growing. And why is that essential? Because there is an incredibly strong link between obesity and type 2 diabetes. If you look at these are the data from the Nurses' Health Study, a very old but very powerful study when a lot of nurses were studied. And if you divide them by body mass index, the nurses that were obese, they had a relative risk of developing type 2 diabetes during the follow-up time that was 50 to 100-fold higher than the nurses that were at lower body weight. And even if you look at the normal body weight, BMI of 20 to 25, the nurses that had a BMI in the 24, 25, they already had a relative risk of developing diabetes that twice as high than nurses that were more lean. So there's strong linkage with obesity. Not just obesity, but also physical inactivity. So when in the same study, they divided nurses by level of physical activity. So these are quintile. These are on the right-hand side are the most physically active, and then left is less physically active. With more physical activity, the risk of diabetes decreased by 50%. So the combination of obesity and physical inactivity is really powerful to induce type 2 diabetes. So to summarize the pathophysiology, these are studies that I've done here in Boston at the Joslin Diabetes Center with the relative of type 2 diabetic patients that were studied for up to 10 years before they developed diabetes. And if you look at 10 years before developing diabetes, the first abnormality was insulin resistance that increased and remained constant for all this time. And beta cells compensate by making more and more insulin. So initially, glucose levels in the upper panel were absolutely normal. And then the first abnormality was post-meal glucose levels started to go up, but fasting glucose levels were still going normal. And then eventually the diagnosis of diabetes, fasting glucose levels are increased, postprandial are increased, and the beta cell failure is a major component down the road.